to lead the first rib. So this one is the first rib. This one is the first rib. Okay. तो ऐसे कैसे देखना है? How to identify this one? This one is the सबसे छोटा है कि सबसे बड़ा है? Shortest. This one is the shortest. And is this one curved or straight? What do you think? This one is curved, right? And if this is the shaft area, if this one is the shaft area, it is, first of all, this one is wide, right? This one is narrow. This region is narrow, but this region is, the shaft region is wide and flat. Okay, so this region, this one, what do you think is this? Head. और head के बाद में क्या आता है? Just below the head, there's the neck. Obviously, neck region is the constricted area, right? Head, neck, and this one is the tubercle. This one is the tubercle, and after that, this one is shaft. In other ribs, in most of the other ribs, there is a twist in the shaft region. There is a twist in the shaft region. Twisted hoga, but it doesn't have any twist, right? It doesn't have any twist. These are basic introductions only. But the head region, that is this region, it will lie anteriorly or posteriorly? Posteriorly. And this region, the wide region, this one will lie anteriorly. And this one articulates with costal cartilage, and this one with vertebra, vertebra. Okay, these are basic things. So start writing. First rib. First write these things, the general features. This one is the shortest and most curved. Shortest and most curved. Then broad and flat. Twist in the shaft is absent, and there is no costal groove present. There is no costal groove present. Right? There is no costal groove present. Introduction. So if this is first rib, what are the borders? कौन सा border है? क्या लिखा हुआ है? This one will be the inner border, बीच की तरफ होगा, अंदर की तरफ होगा. That is the medial border. और बाहर की तरफ जो है, that will be the outer border. This is the inner border. This one is the outer border. And surface लिखा हुआ है देखो, upper surface, and this one is the lower surface. This one is the upper surface and this one is the lower surface. इसमें क्या होता है? The lower surface is smooth. Whenever you touch, the lower surface is smooth. Superior surface में, upper surface में there are grooves for subclavian artery and veins. तो वो वाला smooth नहीं होगा. Only the inferior surface is the smooth surface. Okay? लिखो. The first rib can be distinguished by, I have already explained, by its small size. The fact that its shaft is, shaft कैसा है? Broad and flat, having upper and lower surfaces and inner and outer borders. Right? The head has a single facet. Head में यहाँ पर एक facet है. Okay? It articulates with the which vertebra? First thoracic vertebra. Right? The upper surface of the shaft has मैंने बताया ना, two grooves for subclavian artery and vein. That's why it is easy to remember. It's named as groove for subclavian artery. So which structure is related to that groove? Subclavian artery. And groove for subclavian vein, which structure is related to that? Obviously, subclavian vein. Easy to remember. ठीक है? Near the inner border of the rib. Near the inner border of the rib. If this one is the inner border, see, if this one is the inner border, near the inner border of the rib, in between both these groups. Which groups? Group for subclavian artery and vein. If this one is the group for subclavian artery, and this one is the group for subclavian vein. In between it, there is a tubercle. There is a tubercle. That is scalene tubercle. Which structure of the muscle is related to this area? See. Which muscle? Scalenus anterior. Scalene tubercle. Related muscle is scalenus anterior. Scalenus anterior. Right? This one is the group for subclavian artery. This one is the group for subclavian vein. And between scalene tubercle, muscle related scalenus anterior. Right? Near the inner border of the rib, these two groups are separated by a prominence called the scalene tubercle. The lower surface of the rib is smooth and does not have a costal groove. मैंने हम लोगों ने पहले भी लिखा हुआ है. No need to write the last line. Just write this. Near the inner border of the rib, between these two groups, there is a prominence known as the scalene tubercle. Which muscle? Scalenus anterior. Scalenus anterior. Now look at this picture. Make a freehand diagram of this one. If you know this picture, you will be able to correlate with the bone. Exactly जो दिख रहा है bone पे भी वही है. There is nothing significant in the inferior surface. That is smooth only. So you have to know how does it look from above. First of all, this one is the head. Anteriorly or posteriorly? It is situated posteriorly. Then in between, after neck, head, there is a constricted area, narrow. That is neck. After that, there is tubercle. This one is the shaft. This one is, and shaft में क्या क्या है? There is a group for subclavian artery. Which structure passes through this? Subclavian artery. Along with subclavian artery? No. Along with subclavian artery? Yes, there is lower trunk of brachial plexus as well. Okay? There is lower trunk of brachial plexus as well. But this is the group for subclavian vein. Which structure is related to this group? Subclavian vein. In between these two groups, there is a prominence known as scalene tubercle. Which muscle? Scalenus anterior. This one is the inner border. This one is the outer border. And this is the anterior end. Anterior end articulates with the costal cartilage. And head articulates with the first thoracic vertebra. Now, side determination. I have already explained. The posterior end will be the, which one? Vertebral end. That is the head portion, right? Head portion is situated posteriorly. Anteriorly? नहीं लिखा है, but anteriorly which area? This one. Wide region. This one articulates with the costal cartilage. Costal cartilage. Superior surface is rough surface. It has grooves, right? And inferior surface is smooth. Medial border में क्या है? In the inner border there is scalene tubercle in between both these groups. Okay, so if this is our scalene tubercle, okay, this one is the scalene tubercle. These are the groups. So this is the inner border, right? This is the inner border. This is the head. Head is situated posteriorly, and this region is anteriorly. How to hold it? This one. But it will make one angle with the horizontal, 45-degree angle. So this one will be the anatomical position. Okay? This one will be the anatomical position. मिडल बॉर्डर में क्या है, इनर बॉर्डर में देयर इज स्केलेन ट्यूबरकल, हेड पोर्शन इज सिचुएटेड पोस्टीरियरली, ठीक है. सुपीरियर सरफेस इज रफ, inferior surface is smooth. This is how you hold it. Left sided, so you will hold it with left hand. ठीक है. See, posterior end, vertebral end, superior surface, rough surface, inner border has scalene tubercle. When the rib is placed on a horizontal plane, anatomical position can be not in anatomical position. If you hold it like this, both the ends will touch the surface. ठीक है. Not in anatomical position. Usually, if you place it on an horizontal surface, both the ends will touch the surface. ठीक है. But in anatomical position, you have to hold it in 45-degree angle. ठीक है. It will make 45-degree angle with the horizon. ठीक है. Posterior end is raised so that the shaft makes an angle of 45-degree with the horizontal. That is the anatomical position. कैसे करना है? ठीक है. Like this. If this is of left side, you have to hold it with left side. अगर right side का है तो you have to hold it with right side. देखो, inferior surface is related to pleura and lung. This is basic only. If this is your first rib, इसके नीचे lung और pleura ही होगा. This is easy, right? Then the muscles. The scalenus medius is inserted into a large rough area on the superior surface. Superior surface कौन सा वाला होगा? Rough surface, right? Behind the groove for subclavian artery. Behind the groove for subclavian artery. So this one is the subclavian artery. This one is the subclavian artery. So behind the, sorry, this one is a groove for subclavian artery. Behind that groove, which muscle is inserted? Scalenus medius. This is what is written here. The scalenus medius is inserted into a large rough area on the superior surface. Behind the groove for subclavian artery. Subclavian artery के लिए जो groove है, just behind that, there is insertion of scalenus medius. So if this is the groove for subclavian artery, so scalenus medius is attached here only. ठीक है. Just here. This is the location of or attachment of scalenus medius. Scalenus medius. See, the scalenus anterior is inserted in the, I have already explained this one. कहाँ पर होता है scalenus anterior? In the scalene tubercle. Scalene tubercle. Scalene tubercle is present between two grooves. Inner border or outer border? Inner border. This one is the groove for subclavian artery. This one is the groove for subclavian vein. This is the scalene tubercle present in the inner border. Which muscle? Scalenus anterior. Now look at this muscle. The subclavian arises from the anterior end of the upper surface of rib and from the adjoining part of the first costal cartilage. Obviously, anterior end of the upper surface of the rib. If this is the upper surface of the rib and this is the anterior end, right? So subclavius muscle is attached here only. ठीक है? See, this is where the subclavius muscle is inserted in superior surface near the anterior end. Near the anterior end. Which muscle? Subclavius. Right? Now see, the serratus anterior arises from the outer border of rib near the groove for subclavian artery. Subclavian artery के जो groove है उसके पास में होगा. ठीक है? Just behind the groove for subclavian artery there was scalenus medius, and along the outer border there is serratus anterior, not scalenus. This one is serratus anterior. So if this one is the groove for subclavian artery, so this is the area where serratus anterior muscle is attached. ठीक है? Now draw this picture. Make a freehand diagram. Now write these things. You'll be able to correlate with the picture. Inferior surface is related to pleura and lung. This is easy to understand, obviously. नीचे lung ही है. The scalenus medius is inserted into a large rough area on the superior surface behind the groove for subclavian artery. You have to at least remember the scalenus medius is inserted in the कहाँ पर? Behind the groove for subclavian artery. Behind the groove for subclavian artery. Then what about scalenus anterior? This is attached in the scalene tubercle. Scalene tubercle कहाँ पर है? Inner border पे. In between the grooves. In between the grooves. Right? In between the grooves there is scalene tubercle. कौन सा मसल है? Scalenus anterior. Scalenus anterior. Now write about the subclavius. Subclavius, where is it present? Anterior or posterior area? Anterior region. Right? Superior surface or inferior surface? Superior surface. See, the subclavius arises from the anterior end of upper surface of the rib and from the adjoining part of the first costal cartilage. Obviously इसके साथ first costal cartilage आके लगता है. ठीक है? And the serratus anterior arises from the outer border of rib. कहाँ पर? Near the groove for subclavian artery. Subclavian artery की जो groove है, the groove for subclavian artery. Just behind that, which muscle? Scalenus medius. Adjacent to it, by the outer border, serratus anterior. In between both the grooves, scalenus anterior. In the anterior portion of the upper surface, anterior portion, subclavius muscle. ठीक है? लिखो. The outer border of this rib also gives attachment to intercostal muscle of the first space. अगर intercostal muscle के origin insertion पढ़ोगे उसमें लिखा होगा, पता होगा. We have taught this during dissection. The outer border also gives attachment to intercostal muscle of the first space. And there is one ligament in the anterior portion. ठीक है? Which ligament? Costoclavicular ligament. This is present between the groove for subclavian vein and the anterior end. इसके बीच में होगा. जहाँ पर subclavius muscle है और जहाँ पर subclavian vein है. Groove for subclavian vein. Between these two, there is one ligament named as costoclavicular ligament. Costoclavicular ligament. The costoclavicular ligament is attached to the rough area in front of the groove for subclavian vein. The costoclavicular ligament is attached to the rough area in front of the groove for subclavian vein. The inner border gives attachment to the suprapleural membrane. Here we have already written this one. The inferior surface of the rib is related to pleura and lung. Now write this one. The groove for subclavian artery lodges. क्या होता है इस पे? Obviously नाम ही है. The groove for subclavian artery. क्या होगा इस पे? Subclavian artery and lower trunk of the brachial plexus. And the subclavian vein में, the groove for subclavian vein, it has subclavian vein. So, see, this is the head, right? This is the neck. This is tubercle. Superior surface, upper surface, lower surface. Lower surface is smooth. This one is inner border, outer border. ठीक है? Now this one is the that one. Sorry, groove for subclavian artery. It is present posteriorly, पीछे की तरफ है. And after that, this one is the groove for subclavian vein. In between these two, scalene tubercle in the inner border. ठीक है? Now the muscles. This one is just behind the groove for subclavian artery. Which muscle? Scalenus medius. ठीक है? Just adjacent to the groove for subclavian artery by the outer border, serratus anterior. On the scalene tubercle, scalenus anterior. In here, subclavius muscle. In between the subclavius muscle and groove of yes, costoclavicular ligament. Okay. See, now there are few structure related to the in the neck region. There are few structures. ठीक है? There are few structures in the neck region. This thing you have to mark up. After reading the theory portion, you will be able to correlate. ठीक है? लिखो. Structure related to the anterior aspect of the structures related to the anterior aspect of the neck of first rib. What are those? First of all, the sympathetic trunk. There is the cervicothoracic ganglion. ठीक है? Then comes superior intercostal artery. Superior intercostal artery. This will be taught in the theory portion. ठीक है? Then comes first posterior intercostal vein. Then comes ventral ramus of first thoracic nerve. Ventral ramus of first thoracic nerve. ठीक है? You have to mark up this one. After reading the theory portion, then you will be able to correlate. The structures related to the anterior aspect of neck of first rib are the sympathetic trunk, superior intercostal artery, first posterior intercostal vein, and then the ventral ramus of the first thoracic nerve. Ventral ramus of the first thoracic nerve. Normally, do we have cervical rib? Which one is the cervical area? This one, right? Do we have any rib there? हाँ? Rib है इसमें? Usually नहीं है. But there is one pathology or variation or anomaly, whatever you can say. There is something known as cervical rib, which is not a rib, but extension of vertebra only. ठीक है? See. This is the cervical rib. This is the cervical rib. This is absent. This is rare only. Very much rare. You may not even get a single patient जिसका ये है. ठीक है? See, what is this? The costal element of which vertebra? C7. C7 मतलब seventh cervical vertebra. ठीक है? At times enlarges to form various grades of cervical rib. A fully formed cervical rib is anchored close to anterior end of the first rib. ठीक है? So whenever there is anomaly, right, there is cervical rib. This is bony extensions. What will it do? It will put pressure or stretching of all the structures present on the rib, right? What are those? Those nerves, muscles, but arteries. ठीक है? Whatever vessels or nerves are present there, it will irritate those things, resulting in symptoms. If there is one nerve, see there are thoracic nerve, there is and lower trunk of brachial plexus as well. So if they put pressure on those nerves, अगर कुछ चीज आके उस नर्व पे प्रेशर डाल रहा है तो क्या होगा इस पे? There will be symptoms, neurological symptoms like कुछ बोल सकते हो? What are the neurological symptoms? Numbness मतलब बांग्ला की बोले. Usually patients come with this complaints only. Sir, অবশ লাগে বলে বাংলাতে. অবশ মানে কিছু ফিল হয় না আর কি, কোনো সেন্সেশন আসে না. And there is tingling sensation. tingling मतलब बांग्ला की बोले झिनझिनी करे, शिनशिन करे, शिनशिन ना झिनझिनी करे. हिंदी में क्या बोलते हैं? झनझनाहट सी होती है, ऐसा कुछ. राइट? दिस आर न्यूरोलॉजिकल सिम्टम्स ओनली. नमनेस, टिंगलिंग. ठीक है? न्यूरोपैथिक पेन कैन बी देयर. ठीक है? एंड व्हाट आर द वास्कुलर सिम्टम्स? अगर वेसल पे कोई प्रेशर डाल रहा है, जो मसल सप्लाई करता है, द मसल दैट गेट्स सप्लाई फ्रॉम दैट आर्टरी, उसमें ब्लड सप्लाई नहीं होगा, क्या होगा? रिजल्टिंग इन सेल डेथ्स, नेक्रोसिस, गैंग्रीन, ऑल दोस थिंग्स. ठीक है? So in case of fully developed cervical rib, there can be neurological and vascular symptoms resulting in something known as, what is this? Thoracic inlet syndrome. See, these are the cervical rib. These are extensions of C7. These are cervical, right? These are cervical vertebrae. This is extension of C7, that is cervical, 7 cervical vertebra. ठीक है? The costal element of C7 vertebra at times enlarges to form various grades of cervical rib. A fully formed cervical rib is anchored close to the anterior end of rib. Then what happens? Subclavian artery and first thoracic nerve arch over the first rib. है ना, हम लोगों ने पढ़ा है पहले. तो this may be pressed or stretched by a cervical rib, resulting in vascular and neurological symptoms. Pain, numbness. Pain भी हो सकता है, numbness भी हो सकता है. Depends on the severity. ठीक है? And there can be tingling. Whenever you touch a nerve, tingling sensation होता है. ठीक है? This is known as thoracic inlet syndrome. Thoracic inlet syndrome. ठीक है?